in our day-to-day practice, we frequently come across the cases of viral infections, especially the upper respiratory infections. And in the year 2014, that is last year, we had a big epidemic of H1N1. All of us are well aware of that. And our today's topic will be concentrating on influenza, especially the influenza vaccine. What we'll be discussing today is about the illness caused by the influenza, what are the current recommendations of influenza vaccine, how the vaccine evaluated, and how it was revolutionized in the recent years. We all know what is influenza. It is a RNA virus, and the route of infection, we all know that it is by the route of inhalation, also by the contamination of infected objects. The virus is highly contagious, causes acute respiratory illnesses, and these acute respiratory illnesses are of two types with influenza virus, which includes annual seasonal epidemics which occur during the winter months or early autumn or late fall in the temperate countries, while it may also have global pandemics which may occur in any of the season and includes multiple waves of lasting more than 1 year. Clinical presentation, we all know that these viral infections, they present with upper respiratory infections, especially there is sore throat, there is running of nose, headache, fever, myalgia, like constitutional symptoms. These infections not infrequently are complicated by bacterial superinfections. The common bacterial superinfections after influenza virus are Streptococcus pneumoniae, Haemophilus influenzae, or Staphylococcus aureus. The virus may also complicate in the way of otitis media, sinusitis, dehydration. Very frequently, as we see in our day-to-day practice, it can also worsen the chronic medical diseases, especially the underlying respiratory illnesses like acute exacerbation of bronchial asthma or acute exacerbation of COPD. In addition to other systemic diseases like CHF, diabetes, even renal failure and hepatic failure. Therefore, influenza may be a milder illness in some of the patients. It may also may take a serious consequences in some of the others. Now, influenza pandemics. The disease is more than a century old. These pandemics were first reported in years 1889 and 1890, where more than 1 million of the deaths were observed because of influenza pandemic. Similarly, after about 30 years, in 1918 and 20, again after 30 years, in 57 and 58, there was pandemic, and the virus responsible for H1N1 or H2N2, and the death toll again more than 1 million. Recently, about 5 to 6 years back, we also had a swine flu pandemic, and the death toll was more than 18,000 in that pandemic. The virus, again, as we all know, was H1N1. Now, which virus causes influenza? We always talk H1N1, H2N1 or H3N2, even H5N1. What is H and what is N? It is important to know about it because it forms the basis of treatment as well as preventive strategies. The influenza viruses are of 3 types, A, B and C. Influenza A virus is the most virulent among them and is responsible for most of the serious illnesses associated with influenza infection. It can infect human, animals and birds, and it is responsible for annual epidemics and pandemics. Why is it responsible for endemics and pandemics? Because as we all know that these viruses, they undergo antigenic drift and antigenic shift. And the phenomena of antigenic shift is most commonly observed with influenza A virus. Now this virus has got two different types of glycoproteins, which are hemagglutinin and neuraminidase. And these two glycoproteins are responsible for its virulence, and these are the targets for vaccination against the influenza virus. Influenza B virus infects only humans, and it is responsible for annual epidemics but not the pandemics. The disease is relatively milder in form, and influenza C virus produces only mild illness and no pandemics or epidemics are associated with it. The current available vaccines, they do not protect against type C virus, and it is very mild. The disease caused by this virus is very mild in nature. Now when we talk of influenza vaccine, what are the indications, or who are the eligible candidates to whom the vaccine should be administered? According to CDC guidelines, routine annual influenza vaccination is recommended for all healthy persons aged more than 6 months. Meaning thereby, irrespective of underlying disease, irrespective of previous any systemic disease, each and every person should receive influenza vaccine. We all know that it is given on yearly basis. According to WHO, people at high risk of influenza related complications should receive influenza vaccine, and these include adult and children, including pregnant women with chronic conditions. These chronic conditions may be respiratory in the form of bronchial asthma, COPD, or chronic infective lung disease like bronchiectasis, recurrent chronic lung abscesses, and so on. Cardiovascular diseases like coronary artery disease and heart failure patients, diabetes and other metabolic disorders, cancer patients, chronic renal and liver disease, immunosuppressed patients, elderly individuals, and children from 6 months to 5 years of age, they should all receive influenza vaccine according to WHO guidelines. Now what are all those individuals who are capable of transmitting the infections to susceptible individuals or high risk individuals should also receive influenza vaccine. And these include, because if we administer vaccine to elderly individuals, for example, if I administer influenza vaccine to an individual more than 65 years of age, he may not develop adequate immunity against the virus. So what is required here is those persons who are involved in healthcare of these elderly individuals or at-risk individuals should be vaccinated with influenza so that they do not transmit the infection to these high-risk population. So healthcare workers should be vaccinated with influenza, both to prevent sickness in themselves and to prevent spread of infections to the high-risk individuals in the community. Women at all age of pregnancy should receive influenza. Breastfeeding mothers, they should receive influenza vaccinations so that they do not transmit the infection to the children. Household contacts of persons in high-risk group should also receive influenza vaccine. Now, what are the Indian recommendations for influenza vaccine? Although it is not currently included in the Universal Immunization Program, but recommendation of Geriatric Society of India that all elderly individuals should receive influenza vaccine. All pregnant females beyond 26 weeks of pregnancy should receive influenza vaccine. According to Ministry of Health and Family Welfare, all healthcare workers, they should receive influenza vaccine. Recommendation of Indian Academy of Pediatrics that all children with risk factors should be vaccinated with influenza. Now, what are the benefits if we administer influenza vaccine to the individuals or high risk individuals or all the individuals in the community? What are the benefits we are going to get with this influenza vaccine? Persons, those who are vaccinated with influenza, they have less likelihood of developing illness requiring a medical visit, and they reduce this frequency by about 60%. So the likelihood of developing the illness with influenza virus after vaccination is very, very less. It also reduces the severity of disease in those who contract the infection, and it also reduces the likelihood of transmitting the infection to the others. So these are the benefits of seasonal influenza vaccination when it is given to individual in the community. This vaccination also reduces the risk of influenza-related pneumonia, that is, pneumonia by the virus per se or subsequent superinfections. It reduces the rate of influenza-related hospitalization by as much as 50 to 75%, and it also reduces the incidence of death by influenza virus by 75 to 80%. Meaning thereby, the individuals, those who are vaccinated with influenza, they have very much reduced morbidity and mortality associated with this virus. Now, the first influenza vaccine was made available in the year 1938. It was inactivated monovalent influenza A vaccine. Then, after the discovery of influenza type 2 virus in year 1940, the first bivalent vaccine was available in the year 1942. And in the year 1978, for the first time, the trivalent vaccine with 2 influenza A and 1 influenza B strain was introduced commercially. How it was made? Initially, the vaccine was made on egg-based media, but nowadays, in last few years, there has been very much revolution in the technology of formation of vaccine, and the first cell culture based influenza vaccine was launched in the year 2007, and first insect cell culture vaccine was approved by US FDA in the year 2013. Now, what are the types of influenza vaccine? There are 2 types of influenza vaccine. One is inactivated and another is live attenuated influenza vaccine. The inactivated influenza vaccines are of again 2 types, the whole virus and the split virus preparations. Now, as I have already told you, there are 2 important glycoprotein contents of the influenza virus. What are these? These are hemagglutinin and neuraminidase. These are very important because of their pathogenicity, and these are the targets for influenza vaccine. Hemagglutinin is important for binding and penetrating the host cell membrane, and immunity against it reduces the chance and severity of infection. So therefore, most of the preventive activity of influenza virus is against hemagglutinin. Neuraminidase is the another glycoprotein component of the virus, which again is very important as far as this pathogenicity is concerned and immunity against it is concerned. Now, there has been a revolution in the technology of formation of influenza vaccine in the recent years, and this technology is called virus-like particle, that is VLP technology. What is this? The VLP technology involves construction of VLP. What is VLP? It is nano-sized particle which mimics external structure of the virus but lacks intact genetic material. So there is no genetic material in it, but it mimics the external structure of the virus and induces immunity in the individual who are vaccinated with it. There is more rapid adaptability to producing new strains than egg-based vaccines. These vaccines can be prepared in a faster way. Once a strain has been identified, These kind of vaccines can be prepared within 8 to 12 weeks of identification of the vaccine of the virus, while other egg-based vaccines, they may take as long as 6 months to get prepared against that particular strain. This technology has also been proven and effective against hepatitis B and HPV vaccines. Now, how these VLPs are constructed? Actually, the genes of the virus, they have been cloned into baculovirus, and this baculovirus then infects the insect cells, and from these cells, the VLPs bud from the cell membrane. They are then concentrated and purified. So this is how, in short, this VLP technology is used for the influenza vaccine. As you can see here, that influenza vaccine has got all the glycoprotein components, H and N spikes and M1 spike, but it is deficient in the genetic material. There is no genetic material in this VLP, but the glycoprotein contents are same as that of influenza virus, and therefore it is effective against vaccination for influenza virus. Now, what are the advantages? As I already told you, the time from strain selection to product release is 10 to 12 weeks. That is very fast. Within 3 months of identification of a particular strain, the vaccine can be prepared and can be administered to the individuals. Another important part of this technology is that it is not egg based. So all those individuals who are allergic to egg, they can be administered with this vaccine. So how these vaccines are presented in the market? They are available with 0.5 ml syringe, dose vial, and they are given by intramuscular route. And they consist of 3 strains, H1N1, H3N2 and type B strain. Type C strain of influenza is not included in the vaccination. As I already told you, the H part induces neutralizing antibody and prevents infection. The N part induces again neutralizing antibody and reduces the disease severity. And the matrix protein have potential to stimulate cell-mediated immunity. So there are multifactorial actions of these influenza vaccine, trivalent influenza vaccines. It has been tried widely in healthy Indian adults, administered by intramuscular route, and heme agglutination antibodies titer were measured on day 0 and after 3 weeks of the vaccination. Now, the results are clearly shown that seroprotection rate on day 21 was much more for H1N1, H3N2 and type B strains of influenza as compared to placebo. And seroconversion rate by the end of 3 weeks was again statistically significant as compared to placebo for all the 3 strains. So what are the advantages of this trivalent vaccine? It is not egg based, number 1, so can be safely used in patients with egg allergy. It ensures exact genetic match to the circulating strains and rapid production. Unlike live attenuated influenza vaccine, since it does not contain intact viral genetic material, it is non-infectious. So it is safe and lesser degree of side effects as compared to live attenuated vaccines. It can be safely used in patients with compromised immunity, in patients with respiratory diseases, underlying cardiovascular diseases and diabetes. So the incidence of side effects or active infections by the live virus, is very, very less when this kind of vaccine is used for prophylaxis. So this vaccine can be used for active immunization in adults against disease caused by seasonal influenza virus subtypes A and subtypes B. It should be given once in a year. We all know that influenza vaccine has to be administered once in a year, and the peak timing of administration is usually month of September, October or November. It is safe and well tolerated. Only minor side effects have been observed following administration of influenza vaccine, which may include headache, nasal congestion or low-grade fever. Its efficacy and safety in children and pregnant women has not yet been established, in whom it should be avoided. Like other influenza vaccine, as we all know that in the presence of moderate or severe illness, the vaccine should be avoided, and once the patient recovers from the illness, then it can be administered. And all patients who have allergic reaction to any of the component of the vaccine, it is contraindicated in them. So overall, if we look for the first recombinant trivalent seasonal influenza vaccine, it is developed with advanced technology, that is VLP cell culture technology, and antibody responses achieved are believed to be associated with reduced risk of influenza and its complication, more than 70% seroprotection rates, free from egg proteins, so safe in individuals with egg allergy, free from intact viral genome, so it is non-infectious, and it is very well tolerated by most of the vaccinees. Thank you very much.